Hey guys, Dr. Davin Lim, board certified laser dermatologist. Today we'll be talking about how to treat dark circles under your eye or dark circles. This is a really broad topic. I've skimmed through it many years ago, but today we're going to be looking at a more in-depth view. So dark circles are very common. It's a very common presentation both to a dermatologist, a plastic surgeon, or an esthetician. Now, dark circles can be caused by lots of things, including hereditary, or it can be caused by allergies, for example, or even the bone structure. Hence, it's very important to figure out what causes dark circles before treating it. So let's go through the causes. First of all, it's constitutional. Constitutional means by race. So for example, Indians, Sri Lankans, Pacific Islanders, and some Asians will have dark circles around the eyes, and that's hereditary. And the way to distinguish that is to actually look at the dark circle and see whether it extends to the upper lid. If it does, that's constitutional. We can do stuff about that, but in reality, there's not much really you can do to make the dark circles go away. I'll breeze through a few things later on. So that's first, constitutional or genetic. Second, anatomical. By anatomical, we mean that your bone structure over here under your eye consists of the zygomatic bone, consists of the maxilla, and it also consists of the lacrimal bone as well, which is down here. So all those three bones form the orbit, right? And if you have a bone which is more, if you have a person that's more bony and with very little tissue, for example, very thin dermis or thin subcutaneous tissue, that's when you can have prominent dark circles. And for that tissue, that's when you can have prominent dark circles. And for that, it's very hard to treat because you're dealing with anatomy. Sure, things like implants can help, but if you're trying to put hyaluronic acid or fillers or fat in people like that, it's not advisable because it can often make things lumpy or even worse. So the third diagnosis is a mix between allergies, both endogenous and also exogenous. So we talk about dermatitis, that's endogenous, means atopic eczema. So you may have allergies, you may have eczema, and as a result you rub your eyes, and that can actually lead to dark circles. In the dermatology world, we call that lichenification. In other words, thickened skin due to excess trauma such as rubbing. The other thing what can happen is actually dermatitis. So there are different types of dermatitis. There's irritant dermatitis, and there's irritant, atopic, which is what we talked about, and also allergic contact dermatitis. So it doesn't mean if you have a rash around your eye, it is actually an allergy, because the eye area is the thinnest skin in your entire body, yeah? It's thinner skin. So you've got to actually respect that, and you can't use too much over-the-counter topicals or actives, right? Because it can cause irritation. So if it itches, generally speaking, it's a sign of both innate allergy, so atopic dermatitis, or like I said, it can be irritant or allergic. And I'll go through how to actually treat those at a later stage. So if you are actually having an irritant reaction, what dermatologists do is that they try to actually bring you back from all the topicals you're applying on that area and just test one at a time. So you can do what's known as a ROAT, R-O-A-T, repeat open application test. Now, in the history of, allergy testing, we often do it on the inner arm here or forearm here. But you can actually do a ROAT in front of your ear or the back of your ear. So basically what you want to do is, if you think that is an allergy, you can actually, instead of putting it around your eyes, you can actually put it on the skin here or the back. Do that every day, see how it goes for 3 days. If you react to that, you know that even the skin here is much thicker than your eyelid. If you're going to put that eye cream here, you're going to get irritation. So by all means, if you do have sensitive skin, don't buy an eye cream, okay? Because you might chuck that in the cupboard. Do a repeat open application test and go from there. Okay guys, let's talk about ways that you can actually use DIY tips in regards to dark circles around the eyes. The first thing, as always, is sunscreen, because for whatever the cause, if you have actually more sun exposure around that area, it can increase the pigmentation. The catch is you've got to use a very good sunscreen because you do not want to cause irritation. So the sunscreen of choice is something like a zinc oxide or titanium dioxide sunscreen. So remember, sunglasses, sunscreen, and protect your skin, okay? Because that can reduce the amount of pigmentation. Now, what else can you do? DIY tricks or DIY, treatments, yeah? So things like decrease the salt intake, because if you decrease your salt intake, you reduce the swelling of that area. The other thing that can help, and I'm not too sure many patients do that, if you notice that your swelling, your dark circles or puffiness is actually more prominent in the morning, that's because of pooling of blood, yeah? Because when you lie down. So the other thing to do, you can try this. I don't know what the success rate is, because the patients that see me usually have tried everything else. So you can actually double up on the pillow. So if you sleep elevated, you decrease the pooling of blood, and that can help. The other thing as well that can really help is all those homeopathic remedies. For example, tea, green tea, or even tea bags on your eyes. So there is merit to that, because if you have swelling, certainly using a cool tea bag can help. But what we know nowadays is that green tea in the tea bag can actually help with both pigmentation. So it's an antioxidant, it's also an anti-inflammatory. So green tea bags in the fridge, you can put it on your eyes, I guess just before sleeping, and hopefully that works, yeah? Because these DIY tips, they have their limitations. Okay, so now we talk about, I guess, allergies, yeah? If you've got an allergy, and if it's confirmed that you have an allergy, or for example, you get sniffly nose, yeah? Conjunctivitis, sniffly nose, and you're rubbing, you can take an antihistamine. So a non-sedative antihistamine like Zyrtec, I know the box says 10 milligrams, but we're quite comfortable to actually double up that dose. 10 milligrams in the morning, 10 milligrams at night. And if you reduce your itch, that can help. The other thing you can try is basically hyaluronic acid masks. So you can buy these in the, I guess, discount pharmacies. They don't cost much, anywhere between $5 to $10. And you can try that, use that at night. So put the hyaluronic mask on, take it off half an hour, 1 hour later, and use a moisturiser. The hyaluronic acid can, in some situations, plump up your skin, and it can reduce dark circles. So once again, if you do have sensitive skin, make sure it's hyaluronic acid and hyaluronic acid only. Let's go through other treatments of how to treat dark circles. Okay guys, so creams. What creams can you buy? Well, unfortunately, there's not one cream that does the whole lot. Yeah, if there was, there wouldn't be dark circles, and that cream would be, I guess, on the pedestal. The answer is there are many, many creams, and there's not one miracle cream. So let's go through the logistics of which cream you should try. So retinol, or retinoic acid, can help by using active aids. For example, a prescription tretinoin, adapalene, or third generation retinoids such as tazarotene. Usually in the area under your eye, you get skin irritation. So I don't suggest stepping up to that. But you can try something like Allergies 0.5, and if you can actually use that, you can graduate up to 1.0. So that's vitamin A. Secondly, vitamin B. Vitamin B, such as niacinamide, is anti-inflammatory. So that causes less irritation than vitamin A, and it causes less irritation than ascorbic acid, which is vitamin C. So you can try some niacinamide, apply it once again at night, and see how you go. Now, vitamin C. Vitamin C, or ascorbic acid, is a well-known, I guess, acid that actually helps with antioxidation. So it's an antioxidant, right? And what it does is that it scavenges free radicals, especially from sunlight and from smoke. The downside about vitamin C around your eyes as well is because it's ascorbic acid with a low pH, you can get some irritation with that. So my suggestion is that you probably try vitamin A first, vitamin B, and right at the end, if needed, vitamin C. Now, what else to look for in an eye cream? So there are a few eye creams out there that actually have active ingredients. So what we want to do is we want to reduce pigmentation around the eyes. Number one, so we can reduce it by decreasing the actual amount of pigmentation. And number two, you want to actually reduce pigmentation by decreasing blood flow. So the first is actually to use something which is known as a tyrosinase inhibitor. For example, licorice, creams that contain licorice can decrease pigment. Arbutin, right, we talked about retinol or vitamin A, we talked about ascorbic acid. Another cream you can use around your eyes is called kojic acid. Now with kojic acid, you can actually combine that with ascorbic acid, you can combine that with a retinol, and that can actually decrease pigmentation. So with kojic acid, be careful. You should actually use a concentration between 1 to 4%. Anything higher, you can get skin irritation. Okay, so let's go through a few other ways which we can treat pigmentation around your eyes. Now, apart from using hydroquinone, so dermatologists often would use hydroquinone, and what we do with hydroquinone, because it's a tyrosinase inhibitor, we compound that in something like a Allergies cream, yeah, because it's more, I guess, cosmetically elegant. So my suggestion is probably start with a 2%. So 2% you can buy Superfade, which you can buy that over the counter. Once again, hydroquinone and the salicylic acid with Superfade may be irritating, so once again with caution. If you see a dermatologist and if you excluded all the other causes, for example, through patch testing or allergy testing, and you've still got dark circles, we may actually prescribe you something like a hydroquinone, something like 2 to 4% hydroquinone once at night. So that can help with the pigment. Now we're talking about blood flow. The reason why it's dark is because the skin on your eyelid is so thin, and as a result you can have blood vessels which show. As a result, that's where you get dark circles. Right, so how can we actually modulate blood flow? We can modulate blood flow using caffeine. So creams which contain caffeine, you can find them in the link below, can actually help with dark circles. Now, right at the end, when you see a procedural dermatologist like myself, we look through to make sure that your dark circles aren't actually caused by a medical condition, an anatomical, nor an inherited condition, and we can approach things from there on. So, firstly, we can use dermal fillers. Dermal fillers, once again, has to be very, very precise in this area because you've got very sensitive skin, but also very thin skin. So the filler of choice I like using is a hyaluronic acid. Yes, Juvederm makes really good fillers such as Voluma, Volif, but I really don't like using Verbella in that area. The reason being is because it is hydrophilic. In other words, it takes in too much water, and because of the cross links, it can actually change in time. So what we have is filler migration. It doesn't occur in everyone, but it can occur in some, even if you put the filler deep. So I prefer using lighter HAs, for example, Bolotero or Restylane, to have a really good consistency so that we can actually blend things in. So definitely dermal fillers, and what you're trying to aim for is between a 20 to 30% correction. We're not trying to actually reduce everything because you still need a tear trough in that area. Okay, fat. So you can use fat as in fat grafting. The problem with fat is the unpredictability of absorption. So actually two problems. First is absorption, because what you put in may not be what you have in 6 months' time. So with most fat transfer cases, I always say 2 treatments spaced out between 3 to 4 months apart. Some patients will need 1, but the, I guess, longevity of fat is not as well studied nor predictable compared with dermal fillers. The other thing with fat that can happen is actually, even if you're using nano fat, using the tulip system or just harvesting, the problem with fat is that it can cause lumps. Yeah, it's not as malleable as compared to a filler. It's not as elegant as a filler, so it can cause lumps. So be cautious with that. Other methods that I use to treat dark circles. Sure, microneedling and PRP has been advocated in a lot of journals, in a lot of, I guess, cosmetic magazines. I don't quite like using that because PRP is not like filler. It's unpredictable. Microneedling, I feel, look, the needle size is actually pretty big, yeah, compared to, for example, a small spot size laser. So personally, I don't quite like microneedling under the eyes because your scarring rate is higher, your bruising rate is much higher, and it's just not as precise as something like a laser. So sure, microneedling, PRP, it has been reported. I don't quite like using it. So when we talk about lasers, the most, I guess, predictable laser is something called a Q-switch laser, because that can decrease production of your pigment, but it also can stimulate collagen. So I like using Q-switch, the 1064, either in nano or picosecond. And the downside about using Q-switch is that you have to protect your eyes, and you've got to fire the beam not straight but actually down, because 1064 goes deep into your dermis, and it's super important you have eye shields in that area. So we talk about Q-switch lasers. What other lasers can help? I like using fractionated lasers as well. 1927, either thulium, as in Fraxel, or diode-driven, which is clear and brilliant. So once again, with fractional lasers, you've got to be extremely cautious, because if you cause PIH, or skin color changes, your pigmentation will be worse. So the treatment parameters have got to be very conservative, yeah? So we're probably looking at 15 millijoules or for the 1927 Fraxel, or even 5 millijoules for the clear and brilliant. And obviously you have to limit your passes. What other lasers can help? Well, if there's a lot of skin laxity, right? So lax skin, which is due to loss of collagen and elastin, what I like to use is basically a fractionated CO2 or erbium laser. So once again, in caution, because patients who are skin type 1, skin type 2 is not a problem, but when you're trying to treat ethnic skin, CO2 or erbium may still be a little bit harsh. So that's how I use lasers. And most patients will require between 2 to 4 treatments spaced about 6 to 8 weeks apart. Guys, that is by all means not the most comprehensive treatment of dark circles, right? There's a lot more. This is just an outline on how I approach things. It is super complex, and realistically, if you do have dark circles and if you have allergies or rubbing, you should see a medical dermatologist to exclude all the other conditions, and certainly a procedural dermatologist, plastics or esthetician to actually treat your dark circles due to the cause. Guys, I hope you liked that video. It's a very short one. Please comment, subscribe, like. And the other thing as well, if you're actually watching this and you want more information, I go through the specifics on Instagram, link below. Thanks guys, bye.